All right, welcome once again. And as I mentioned in the first video, this is going to be a continuation of our learning on how to search and retrieve the scientific or research literature. In the first part, I actually mentioned the fact that there are degrees of openness or that our access to the literature are not necessarily a straightforward issue. There are sometimes that we try to get a certain material and we are not allowed to get it, or we are requested to pay a certain amount to have it. Then we look at options for getting around such paywalls. And that took us into open access. We looked at open access publications and how to discover them. We looked at a few discovery tools. And we also looked at the search platforms that are available for open access search. Under discovery tools, we looked particularly at research papers and open knowledge maps. For the search platforms, I simply mentioned, for instance, the Mendeley search engine as one particular search platform for open access documents or publications. And in this part, I'm going to be focusing particularly on the types of search, beginning with a simple search. So let's start with our item number 2. And I'm going to be very fast with that. In this very part, I'll be concentrating on the first 2. That is the basic keyword search and the advanced. For systematic search, I'll leave it for a separate session because it is quite involving and it will take care of several other things. All right, so a bit more technical. So I'll deal with these 2 and close the second part as well. All right, so what is a basic search? Now, the previous examples of search that I did, and perhaps you can return to those search engines that I used. So I can go to scholar.google.com. That is Google Scholar, which I believe many of us who attended this particular event have been using already. All right, the system is trying to check a few things. I'm not a robot, but should we take me through all this trace? Motorcycles. All right. Good. So for many of you who are conversant with Google Scholar, and I've been using it, all right. Usually you just enter your keywords here and you do your search. Okay, in this interface, unlike what I even shared previously from the Douage database, there's no way of even finding out whether there are any search fields. No, there's nothing. It's just a plain search engine. So if I put in here, what terms should I use? Should I go back to our original mortality, maternal mortality? Let's do something that will benefit others as well. So let's say plastic pollution. All right, it's even indexed already. Plastic pollution. All right. Now, if you have something like this within less than 0.05 seconds, it gives you so many results. Unfortunately, Google Scholar doesn't have too many advanced features, but I'm starting from here before we move into databases that have more features. But at least you have got over 1 million results. 1,970,000, so close to 2 million results. This is what we call a basic search. Okay, this is a basic search. Now, we do not know how the system actually came by these results, but at least you can look through and see from the titles that they look relevant to what we have asked for. Plastic pollution is an HTML content, as you can see from here. It's available in our world in data.org, our world in data.org. Have you seen that? Then the second result, plastic pollution and potential solutions. This one is from Sage, the publisher Sage. Okay, so the PDF is available. It's a 2018 publication, the first one is 2018 publication. Then evaluating scenarios toward zero plastic pollution. So, of course, you can just go through result by result. If you want to open any of these results, okay, and here I'm going to open, but I will not open by clicking. I'll right click, okay. Sorry, my pad didn't do what I wanted to do. I wanted to do a right click, then I choose open link in new tab. The reason for doing this is that I want to keep this particular page, but I want to open that result. So I've opened that result, and it is by Hannah Ritchie and Max Rosa. All right. This article was published in September 2018. Okay, that's fine. So our welding data, and I can just scroll down to see what the material is about. They give a summary, charts on plastic pollution, how much plastic enters and was oceans and all of that. So if you're interested in this topic, then of course you can just try. Google Scholar has given you such a great, source for such information. Then I can go back to my results by moving to the tab just on the left. What I would like to show again is here, you can see that the result, typical of most academic databases, is displayed in such a form that you can have access to the list of results, and then there are other links pointing to other things connected to the result. For example, on your left, okay, on your left, you have this vertical space that gives you filters facet, or what we call limits. So you can limit these results to only publications in 2021 or since 2020, or you can put in a custom ring. You click here, it allows you to put in your from and your to date. Then you click on search. Have you seen that? All right, let's suppose I want to use since 2020. So it has reduced from over nearly 2 million results to just 43,000 results. Have you seen it? So those are some of the behaviors that you usually, put up when it comes to searching. You are trying to refine your results. You want more current results. So all the 2018 publications are gone, but more current doesn't necessarily mean more relevant. All right. So that is one thing that you have to balance. When you are doing a search, you are the one in charge, because the question is yours. The direction of the research is best known to you. And so when you find what the system is giving you is not what you want, you can always change or massage your query, or even the tools for refining the search and all of that. You can use them in such a way that it brings you the most precise results. Those are some of the things you're going to be looking at. Now, apart from the year filtering, there are other filters. One, it says sort by relevance, sort by date. Now, which one do you think should be the thing? The ones in red, okay, the ones in red you are seeing are the activated filters. So currently it is sorted by relevance. So it means that, for example, the first document here is found by the Google algorithms to be more relevant to your search than the third one. Because the third result is the global threat from plastic pollution. It's a 2021 publication, but you see that it is not top, it is third. There are two 2020 publications ahead of it in terms of the order. So it is sorted by relevance. If we change it to sort by dates, you see that the most current documents will come first, but not necessarily the most relevant. All right, then how about the next filter about the type of article? Here it says any type. So here it includes all manner of research, primary research, reviews, systematic reviews, whatever. So what if I want only review articles? From 43,100, it is now 9,980. Have you seen it? Good. Then, of course, create alerts. I mentioned this, maybe I should just start talking about this from here. Now, how do you create an alert? You need a Google profile, okay, to create an alert. To be able to create an alert in any system, you will need to sign in as an individual or create an account on that system. So you will use the system's, profile to create a dashboard for yourself. They usually require your email and any password of your choice. that will match the convention there. So some of them will tell you alphanumeric or caps and special characters and all of that. So whichever convention they provide for their password or security or authentication, you do all of that, and they create your profile or your account. And you usually have a dashboard, all right? So if you did that and you have a Google profile, then you can actually create an alert. So this is your search topic. And so you see that it has picked this. It says plastic pollution. That is your search term. And it wants to create an alert for this. It's because I'm currently using a Research for Life email address, so it has picked it automatically, but I'm not really going to do this. I'm not creating this for Research for Life, GH. All right, so if I wish, I'll put in my own. And at this point, you see why I mentioned that I'll suggest you use Google Chrome as your specialized browser for research. Because all these services by Google, you can just run them across on a single profile. So you have a single Google account, which is running your email, is doing your Google Scholar searches and profile, is doing your YouTube, and all at the Google Workspace. If you want to use Google Docs, Google Sheets, Google whatever, so just a single account. You are doing all these things across. That is why I propose a Google Chrome. So get a Google account if you are doing research. Even for advanced researchers or experts, Google profile is important, particularly the Google Scholar profile, to showcase your work, all right? So I'm not going to create or set this, but all you have to do at this stage is to just press this. Okay, create alert. And you can see you have a choice to indicate how many results you want to show. So what happens is that any time that Google indexes any new publication on this particular theme that you have chosen, the plastic pollution, Google will give you an alert, and it will actually add it up to your collections. And let's see how the collections work. So I'll just go back. All right. Now with the profile, setup, apart from creating alerts, which can drop items in your library, you can see my library is right here. You can see that my library has a particular icon, the star. And when you look under each of the results, you can see a star. Okay, that star is for saving that particular result. If you think the first result here is good, you can just star it. Once you star it, Google will actually place it in your library. So next time you come here, you just go straight to your library, and all the items that you start from your previous search will be available there. You just go to them straight. You will not need to repeat that search again. Okay, by that time, perhaps you will forget the particular search terms that you use. But once you have started results or saved them, they are all going to be right here in your library. And if you have created a profile, if you go here, all your research and whatever it is that you have added to your profile will show. And for those who are well published and you have added your research to Google Scholar profile, you will even see how you are faring in terms of citation, your H index, and all of that. Okay, but we are not going to any of those things. Now, on the right side of the result list, you see the links to the full text, and it tells you even the formats. So HTML contents, PDF, and where are these things coming from? So for example, one from UBC is a PDF, another from ResearchGate is a PDF, but the one from Science Direct here is an HTML. Can you see it? All right, so those are the basic things that I want to talk about here, plus something else. Okay, now after the save or the start, you also see cite. Okay, cite. Sometimes you want to find out how this document will be cited. You just click on cite. We are going to be dealing with mainly reference management. Okay, so Google tells you, okay, about 5 formats: MLA, PH, Chicago, Harvard, and Vancouver. If you want to cite this document or reference it, this is how you do it. And if you want to export it to a citation management software, then these are the various supported ones from Google Scholar: BibTeX, EndNote, RefMan, and RefWorks. Of course, BibTeX is something Mendeley can ingest. That's a Mendeley stable version, which is the Mendeley desktop. EndNote is usually an NBibTeX or a .res format. And the current or the new Mendeley, which is the Mendeley Reference Manager, is capable of also ingesting the EndNote formats. All right. So depending on which Mendeley you're using. If it's the reference manager, you can use this one and to still ingest it. If the old one, the Mendeley desktop, you can use the BibTeX and you'll be able to import this particular file when you open your Mendeley. Then apart from that, you remember that when I showed the power of connected papers, I mentioned two tabs. One was previous works and the other derivative works. And I spoke about citation chaining, all right? And I said that the previous works link there referred to backward citation chaining because it is simply like watching or looking through the reference list of the current paper that you are reading in order to find papers that are related to it. But it is backward because all the papers that are cited by the current paper you are reading are definitely older than the one you are reading. So it is called backward citation chaining. I also mentioned that in online systems or databases, it is very possible to have forward citation chaining. That means it is possible for the system to give you relevant articles to what you are reading now by way of what other publications or articles have cited what you are currently reading. And that is forward citation chaining because definitely items or publications that are citing the one that you are reading now are newer or more current than what you are reading. All right, all that process of citation chaining, whether forward or backward, is something you can simply refer to as snowballing, okay, snowballing or pearl growing, all right? Pearl growing or snowballing, because you are moving from one particular publication in order to locate others. You are using a relationship that current one you have has with others in order to discover them. So that is a snowball kind of search, okay? But what we have done here by putting in a simple search term like plastic pollution is what we call a basic search. And I explained that we say it's basic because here we just simply enter our search terms as we have it. We don't do anything technical about it. We don't even know how the search engine is actually translating this search, behind the scenes and where it is looking. We don't even know. All we know is that we submit and we have results. But if you're using a scholarly database like Google Scholar, you realize that at least when the results are displayed, it gives you some levels of agility in terms of how you can refine the results by time or date, that is currency, or by sorting it in a particular order, relevance, or by date, or the type of publication it is, and several other tools like how to create alerts, save the search, create a profile. So it gives you those kinds of added value. How about if we put this particular search? So I'll copy it from here, the same search term in Google itself. Okay, so let me create a new tab, and this is google.com. Google is not scholarly, it's just a general search engine. I put it in here. And how many results have you got? You have got 232 million results. You see the difference? So in Google Scholar, the highest we had was 1,970 something, 78 or so thousand. It was less than 2 million. But in the normal Google, you have 232 million. Now, of course, Google results will come from diverse sources and in diverse formats. So what normally happens is that you find people doing basic searching, these kinds of environments, and they try to apply their own custom filters, okay, custom filters. And this is what they do. And it is fine. As I said, don't forget, any type of search you are doing is perfectly fine, as long as it brings the results, okay? So people will add PDF to this, okay? Or even .pdf. Let's try that and see. From 232,000 million results, at least it has reduced it to 320,000. Whoa, so that filter was great, all right? So you see, the moment we added .pdf, what did you see? It now brings results and says scholarly articles for plastic pollution. Have you seen that? And when you scroll down, definitely you are beginning to see things like ResearchGate, IJEST. This is a journal. Have you seen it? So definitely the .pdf does a magic, all right? It does a magic. So it clears how many? Oh, we have 232 million. It's now 320,000. So hundreds of millions are already gone. That is what filtering helps you to achieve. Okay, when you filter your results, you are able to narrow down to something more relevant, something more specific to what you really wanted. All right. Now, apart from the PDF, I think some people even add the names of authors. Okay. Some people add what again? Years. So let's say PDF. Let's try adding 2021 and see whether our 320,000 results will change again. So we search again. Whoa, something has happened again. Have you seen that? So from 320,000, it has now gone down to 230,000, almost 100,000 gone. Wow. So that is it. And it is interesting what people can do. And as I said, these are all valid as long as it retains results that are useful. Of course, the results you are getting from the normal Google here, they are not bad. They are all very good. But still, even with all these filters we try to apply to reduce from 232 million to 230,000, the 230,000 is still way, way, way higher than the how many 9,980 that we got when we had the flexibility of refining the results by choosing the timelines or the currency of date, by choosing the sort order, by choosing the type of article. We still got better with the scholarly search engine. It's the same Google, but the scholar version of Google did way better than the normal Google. Now, I'll use one last example to demonstrate the basic search. One last example. And I'm going to take this from Pubmed. Okay, Pubmed. Now I am getting back to the biomedical sciences, all right? Okay, so, but I'll not go through Research for Life. Please, the open Pubmed. Pubmed.gov. So again, in Pubmed here, I'm simply going to do a basic search. And by basic search, I mean, I'm simply supplying my keywords, okay, just like that. Not necessarily careful about where is the system searching, how exactly is it in the search. No, I just want to do a broad search for a topic on what is common now. If I use COVID-19, the results will be too much. So let's say dengue fever. Fever, yeah, that's what I want. Now you can see that the Pubmed autocomplete begins to, once you start, it begins to give you suggestions on how you should complete your search term because it has already indexed certain terms. This happens in all other searches, and even in Google, you can see Google Scholar. One good thing about this is that it tells you what the system has already indexed. And so at the time of making your own input, if you look through the suggestions and you think that there is something that the system is suggesting to you, which is more narrowly related to what you are looking for, then it is good to pick the system's own suggestion. For example, dengue fever is what I had in mind, but then it tells me treatment, epidemiology, children, prevention, have you seen that? So what if in my mind, I actually wanted to read broadly on dengue fever, but I was interested in prevention? Okay, then I can decide, okay, fine. So there's even a better index term here for me. I'll simply just go for that one. And once I do that, Pubmed has done its search and has brought 6,420 results. Now, As I mentioned, I'm going to use Pubmed here again to give us a clue about what basic search is. And then I'll continue quickly with this to deal with advanced search, because we were not it was not possible for us. We were not able to do advanced search in Google Scholar, because Scholar doesn't have any advanced search. Well, I don't think I know of that. Does anybody know about Scholar having an advanced search? I don't know. Now, so in Pubmed, we have 6,420 results. And similar to Google Scholar, you can see the results are displayed in such a way. The main list of results is right here in the broader pane. On the left, you have the filters facets. Say my NCBI filters. And here are the facets. You have the results by year, similar to Google Scholar. Google Scholar also had a date or currency filters. Then Pubmed also has the text availability. Now, Pubmed has the date graph. So it tells us that the results for dengue fever prevention date as far back as 1947. But of course, are we interested in 1947 results? In the medical and health sciences, I think that, well, depending on supervisor or institution, the policy will usually limit you to about the last 5 years. So if you have a 2022 result here, it means that we can go as far back as 2018. All right, but 1947 is quite, unless you want to do a trend analysis in terms of publication, which is already showing, if you look at the graph, that not much has been done until when you begin to move closer to 2022. See, so I'll move it to 2018, I guess, yeah, 2018 here. Then Pubmed will now resort. And from 6,420 results, between 2018 and 2022, we have 2,064 results. 2,064 results. Now, that is just one of the filters. Apart from the date graph that I was able to readjust by manually dragging from the earliest, that's the oldest publication, that's the left to the right. When you move down, you also see that the publication date has options. So you can do the last 1 year, last 5 years, last 10 years, or put in a custom range, just as we did for the Google Scholar, all right? Now, apart from the date, it talks about text availability. So do you want results which only abstract are available, or you want results with full text? And when it comes to full text, Pubmed gives us the leeway of choosing whether we want only results that have free full text. That is, their full text is accessible free of cost. Because as I mentioned, Pubmed does not contain the full text of any document. It is a bibliographic database. And so Pubmed will simply give you the publication details and the abstract or summary of the document. But for you to get the full text, it will give you a link to the publisher's site or to an archive where the full text is stored. And for all free full texts that are paid for by the NIH or the National Institutes of Health, Pubmed will give you a link to the Pubmed Central Archive, PMC. All right, so here you can choose. If I indicate that, well, I need those results that have their free full text available, then it is going to sort the 2,000 plus results. Now it has reduced from 2,000 to 1,500. So it means over 500 plus results were again not going to be accessible free of cost to us. But at least the abstract may have been there, we'll consider it. And of course, it is not always that you need to have access to what is free, all right? Don't forget, we indicated that it is possible your university library or your institution or your company, whatever organization you're coming from, school, college, they may have already subscribed to certain databases. And you know, a database contains a lot of data sources and types. So you can have a database like Science Direct that contains thousands of journals. You may not know the specific journal that your library subscribes to, but through database subscriptions, they actually have access to hundreds and hundreds of journals. So it is possible that you already subscribed to the results. So it is good. You can leave it full text or leave everything there. Don't check the free full text. And if you have any interesting article that does not give you full access, contact your librarian. We are going to look at how we are going to contact the librarian or what elements you can pick from this page to contact the librarian, but not right now. Now let's continue. We go down, and before we go down, notice this. The moment we selected anything from down here, it tells us filters applied. Free full text. That is one of them. Now, by dragging the date graph here, it did the sorting all right, but it does not indicate that it is a filter we have applied. All right, because it's not a checking activity. This one is a manual dragging, and the system doesn't record that. It is your own interest. But if you want the system to record the filters you have applied, then you have to check them. That is why the year ring is still there. So we are going to pick the date for the last 5 years here. And when you come up, you see that now filters applied a free full text, comma, in the last 5 years. And the results are 1,876. All right. Very good. So if we move down, there are others you can look at. For example, do you want publications with associated data? Yeah, some of the publications have come with their research data. If you want it, fine, you can decide to check that. But I don't want it, I'm not checking that. What type of publication are you looking for? Are they book chapters? Are they clinical trials? Are they clinical trials? Meta-analysis, randomized control trial, review, systematic review. At this point, I would like to worry the entire group with these terminologies. The health scientists here understand what all these things mean. These are, medical science or health or medical research things or terminologies that they are referring to here. Then, of course, you can add more filters. Look at this, add more filters. And because this is not a Pubmed, tutorial we are doing, I don't want to go into things that will confuse other people. So generally, searching any database, these are the sort of things that you should expect to see. Now, don't forget, when you set filters like this in any academic database, remember to clear them if you don't want them to be applied to your next search. So for dengue fever prevention, we have applied these filters, free full text, and in the last 5 years. If you don't want your subsequent searches to actually apply these filters automatically, then just click on clear all, or simply scroll down the filters facets and uncheck. If you click back in this, it will uncheck. If you click back in this, those will uncheck. And then it means that all your results will return to the default as we had it before doing all this refining. Now, all these things that we are doing is what we call refining of the results. Refining of the results. But here, I'm going to take you to the next level. Moving from the basic search of just putting in any search term for what we call a scoping search. You want, as you can see, moving all the way from Google Scholar, comparing with Google, coming to Pubmed. It is clear that when you do a basic search, when you don't know exactly how the system is translating your search terms and where it is looking to locate this piece of information, the likelihood is that you are going to have an explosive result or number of hits. 200 plus million results, even in Pubmed, over 4,600 or 6,400 results. It's way, way too much for any human being to read. You won't be able to read that. And so all the other tweaks that we're doing to the results, looking at the date range or the currency, looking at text availability, looking at the type of publication. For example, I could decide to go down here, apart from the last 5 years, indicate that, well, I'm only interested in systematic reviews, because I'm talking about preventing a disease. So I want to know what is the evidence, okay, about what the effective ways of prevention are. So I go for systematic review. If I do that, then 1,800 plus results have reduced all the way down to 39. This looks more manageable, okay? All the way from 1,800 plus results, because I'm selecting only a certain type of study, systematic reviews, I now have just 39. Of course, I'll be able to read 39 articles if I am really interested in prosecuting that small area of research, preventing dengue fever. Now, another thing I said about the basic search is that we call it basic or simple because we have no idea where the search engine is looking, what the algorithms are actually interpreting our terms to mean to the search engine, and how they are getting these results. We don't know. We simply know we are getting results by putting in search words. Now, over here, if you look at the results we have, the words do not appear as a phrase. We put in the phrase dengue fever prevention, but there is no phrase like that in what we are seeing in the summary of results. We can see dengue hemorrhagic fever. So there is a word, hemorrhagic, between dengue and fever. That was not how we presented our search terms. Then it continues, a systematic literature review of current perspectives on pathogenesis, prevention, and control. Then if you look at result number 2, global epidemiology of dengue outbreaks in 1990 to 2015, a systematic review. So here, only dengue comes up. We don't see fever, we don't see prevention in the title. Okay, I'm reading just the title. So it tells you that the search engine was not looking in a particular place, it was looking everywhere. Okay, because in a title like the title number 2, where fever never appears, prevention never appears in the title, when you look at the brief abstract here, you can see it says dengue is an arthropod-borne infectious, whatever, but then you now see fever here. Fever, then dengue comes again. I am sure if we open this result to read the full abstract, you'll now see the word prevention. So fever never appeared in the title, only dengue outbreaks. That's what you see there, all right? But right in the abstract, you can see the word fever. And possibly we are going to be seeing prevention as well. You can see the ellipsis here. So there's more under the abstract. If you open, we'll see it, all right? Now, that is what the mystery of basic search is. And that is why it gives us so much result, because we are limited in how we narrow the search. In basic search, the searcher doesn't have enough control over how the search engine works. Apart from our own ingenuity, like we demonstrated in the normal Google search, where somebody can decide to add .pdf or even a year of publication or an author's name as a way of filtering the result, there is no other way, okay, of a user or a searcher using any tools available to tell the retrieval system directly how he or she wants the system to look for the results. That is why we say it's a simple or basic search. And usually it is useful when we are doing a scoping search. Scoping search here means that we are doing a very broad search on the topic, and we want to gather all that there is, okay, to know on that topic, just to have a fair idea. So how much work has been done on this? That's what a scoping search is about. But if we want to move into the narrow areas or aspects of the topic, okay, and deal with real evidence, not to read too much, about a topic that are not necessarily relevant to our niche area of focus, then we'll have to move into what we call advanced search. Because in advanced search, we get the ability to control how the system works, okay, by determining for the system where to look, how to combine the search terms, and all of that. That reduces the results so greatly. But again, that can also yield 0 results when you misapply the tools. Look at how it works. All right. Now, before I do that, maybe I should show you one last thing about Pubmed. If you look here, we have save, email, and then send to. I already mentioned some of these. For example, when we were in Google Scholar, we saw how to create alerts. It's also here, create alert. So if you have put in any search terms here, and you want the system to give you notification as to when new publications come in the area of dengue fever prevention, then simply click on create alert. This will force you to create what we call a My NCBI account. Okay, And so, as you can see here, that's what's going to happen. It will ask you to use any of these to log in. If you have the Era Commons, the Google account, OC ID, you can see all of them. You can use any of these. If you have an NCBI account, great. That is, Pubmed's own system. So you can use any of them to create your alert, but we are not creating an alert here. So let's simply go back. All right. Another one I wanted to show is, yes, save. You can save this search. Okay. Now, but before you save, sorry, you are saving the citations, okay, to a file. So are you saving all the results on this page, or take down the options here and see a selection? In that case, you have to tick. You see that there's a checkbox before each of the results. Let me cancel this for you to see. You see, there's a checkbox beside each of them, so you can check each of the results that you want. And then when you go to save, you will say save selection, and it will save the citations for only those checked results. What about send to? If you click on the send to, you want to send the citation to either a bibliographic manager or a citation manager like Mendeley, EndNotes, Zotero, whatever, okay? Or you have your notepad. If you create an account, My Bibliography, it will go into your NCBI account where you created the alerts. If you have built collections, clipboard here, we all know what clipboard is. It means that you can go and right-click in maybe Microsoft Word and say paste, all right? So those are the options here, but they are not even my worry now. I'm looking at this side. Remember that when we were in Google Scholar, we spoke about the sort order. Google Scholar gave us relevance and also date. Okay, we could arrange the results by date of publication or by relevance. Now let's look at what the Pubmed default is. The Pubmed default says best match. Best match. So the best match here is what you can map onto Google Scholar's relevance. Okay, but what other options do we have? If you click on the option settings here, you can see that we can even change the format in which the results are displayed. Currently, it displays summary. Now we can choose to display the abstract or the PMID, Pubmed, whatever. These are all options. You can try it and see how it works. Sort by, we can also change the sort order and say, okay, we want the most recent, or use the publication date, the first quarter, journal, whatever. But don't forget the statement I made even in Google Scholar, that when you sort by the most recent publication, it is not necessarily the most relevant to what you are looking for. So I would prefer that anytime you are searching for academic or research purposes, unless you want to just test the system for whatever, that's fine. You can play around, that's good. But if you are doing a serious search, the most important you're looking for is precision or what we call sensitivity. Okay, you want high precision. You want to be very, very close to what you are looking for as possible. And so leave it at relevance or best match. Pubmed uses the word best match. Many other databases will say relevance. So leave it at relevance. But beyond that, it also tells us how many results are displayed per page. So on this page, currently, there are only the first 10 results displayed. First 10 results displayed. You can change this, okay, to the first 20, first 50, 100, 200, all of that. Now, there are only 39 results here. So we can decide to change to, let's say, first 50. That will cover the 39 results. That means we now have a single page. Okay, so we'll get all the 39 results by scrolling from top to bottom. And you can see the results are numbered. So this is the result number 39. That's the last result. And it tells you it's page 1 of 1. There's no next page. It's only one page. However, we can move back and decide to maintain the original, number of items, which is just 10. If that happens, when you scroll to the bottom, you see the last result there as 10 for the first page. Then it now tells you there are 4 pages. So you have page 1 of 4 currently. You can see the link, the blue link here for next now. So if you click on next, it's going to take you to page number 2 which starts with result number 11. Now, these are just the basic things that happen when you are doing any search at all. And I know most of you are already familiar with this, but just a way of rehashing, to understand this is what you see, okay, when you are in, this environment. So we'll go back to the first page and look at how we can read a result. So let's say we are interested in the first one. We'll just click on the title and it opens the full summary for us. It starts first by telling us the source. So this is a Journal of Microbiology and Immunology Infection or something like that. Okay, if I just point to it, the full name will come anyway. So Journal of Microbiology, Immunology and Infection. Okay, I think I've done well. Pubmed gives you a shortened form, but if you already know the journal, you can easily, mention it or just point to it and it will give you a screen tip that displays the full name of the journal. So nothing is lost. Now, apart from that, it gives us the year it was published, even the month, then the volume number 53, the issue number 6, and the page range 963 to 978. And very importantly, the DOI. I mentioned earlier that I was going to tell you how will you communicate with your librarian if you come across a particular publication that does not give you open access or free access and you are not allowed to take the full text of that document and you want to find out if your librarian can help you to access that content. The easiest way to do this and not give your librarian too much trouble is just to pick the DOI. The digital object identifier is a unique digital address, okay, that is assigned to a particular scientific publication that is hosted online. And many publications now have a DOI. Of course, not all publications have DOI, that must be well noted, but most publications in modern publishing practice have been assigned a digital object identifier. So not only on the Pubmed interface here, any other search interface, it can be Science Direct, it can be Taylor and Francis, it can be Scopus, wherever you are doing your search, okay, environmental, index, whatever, CINAHL, the EBSCO databases, just imagine whatever, it is possible to get the DOI. If the DOI is given, then please copy it. That is the easiest way of helping your librarian quickly identify what you are looking for and then give you any assistance. In the absence of that, of course, the traditional approach is to copy the entire title and perhaps the authors, and sometimes give us the full reference, okay, full reference. So copy the title, the authors, and maybe the publication information like the journal and all of that, the volume, even though now we don't really need it, okay? So simply just click on Cite here. You can see here, Cite. If you click on Cite here, Mendeley will give you a default of NLM, that's the National Library of Medicine format, which is actually a Vancouver, okay? This is actually a kind of Vancouver style. So you can copy this and send to your librarian. You can just click on copy here and it copies. Or you can change the citation format here. AMA, APA, MLA are all supported. You can change this to APA and then copy this and send to your librarian. I need this particular, the full text of this particular reference. Okay, but you don't need all of this if you have the DOI. Now, for those in the biomedical and health sciences and who would like to use Pubmed, Pubmed, besides the DOI, also gives you what we call the PMID. And it is right here. You can see, you can follow my mouse pointer, okay, PMID. So every document that is indexed in Pubmed is also giving a unique Pubmed identity. So if you copy this PMID, just let your librarian know it's a PMID. The librarian will actually try and locate this document for you. Now, apart from using these identities on a particular online document in order to request assistance from the library, the next sessions that we are going to be dealing with on how to, build your Mendeley library and use the library to, cite your sources when you are writing your research or any paper you are doing, will also require these important tools. If you know the DOI of a publication, it is very easy to build a library with the DOI so that the system will automatically link up with online catalogs and download the publication information for you. You will not need to go and be entering all these things yourself. So just by searching the DOI in Mendeley, Mendeley can connect and get all these, the journal name, year published, volume and issue numbers, page range, title, the authors, even abstract, everything. Mendeley can get all of that for you with just the PMID or the DOI. So those are important elements you should not forget. Now, going back to the results list. So this is how you access a single result if you want to read it. Okay. Now, interestingly, in Pubmed, you also see that we have a link for similar articles. So nowadays, it is not really a common thing to say, oh, I'm not getting more, I'm not getting no. Most of the systems right now are leveraging, artificial intelligence, okay, to do a lot of text similarity, indexing. So they are able to map you onto related publications. And so once you get one very relevant article, chances are that you are going to get many more relevant articles. So right within Pubmed, it tells you, okay, fine, there are similar articles, all right? And sometimes it even tells you that there are others citing this particular document so that you know that, okay, you can chase those other documents as well. Then, of course, Pubmed gives you links to the full text. So this is an Elsevier open access publication. So over here, you can just click on the Elsevier, this particular tab. It says full text links. You click on this, and let's just try it so that you understand what happens. You click on this, it is going to open the publisher's own site for you. So now we are moving away from Pubmed, and we are now in Science Direct, which is for Elsevier. And this particular journal, Journal of Microbiology, Immunology, and Infection, okay, is, I guess, open access. If not the journal, sometimes it is not a journal that is open access, but the article within the journal. We call them the hybrid journals. So the journal may be closed access or subscription based, but a particular article in it can be paid for through what we call the article person charge, APC. Okay. So it may be the document itself for this particular article that is open access, but the journal is not. So it says download straight. So you just click on the download PDF. And maybe if I can demonstrate that, you can see that Science Direct is giving us access to the PDF. And right here, we can see the options to get it, print or download. It's a 16-page document. If I scroll, you see all the pages. That's it. The full text is right here. All right. So I'll simply click on this down pointing arrow, download, and then it gets on my local machine. All right. So with all of that explained, I think we'll move away to the next thing that I wanted to talk about on searching, the advanced search. And I won't waste too much time on that because all the interesting things that we have seen about the simple or basic search, how after completing the search, we can refine the search, use all these filters and, use certain IDs like the DOI, PMID, and the rest to try and get information on the document, how we can link out to the sources using such links as what we have here, full text link, whether it's a tab or if it's any other database, you see download PDF and all the things that we have done right now. They are similar to what you do in advanced search. The only difference is that at the level of searching, there are several things that you can do, all right, at the advanced level, which may not be possible when you are in basic search. Now, before I do that, I showed you some particular results, and I think I should share an interesting trick, okay, that you can use. We have techniques for limiting searches beyond using the filters that are preset by the database. I gave you an example where if you look at result number 2 here, dengue fever prevention does not show in the title or anywhere in the document as a phrase. So let's see. What if we want results in which dengue fever prevention stands together as a phrase on its own? Mind you, there are only 39 results here, and we have plenty field tests, systematic review, free full text, and last 5 years. If you want to do an exact phrase search in most databases, what you do is to put this phrase into double quotation marks. Okay, so it is also a way of limiting the search. So when you do this, you are telling most search engines that you want documents in which this particular phrase occurs exactly this way. That means you cannot have this instance where result number 1, for example, says dengue hemorrhagic fever. No, because there's no hemorrhagic in our phrase. By putting it in double quotes, you are restricting the search engine to only results where the exact phrase occurs. So if there's any word between dengue and fever, that document will not be retrieved. If there's any word coming between fever and prevention, that document will not be retrieved. So let's see this simple example or technique, how it works. So I simply do a search with the double quotes around my phrase dengue fever prevention, and let's see what Pubmed retains. Very good. Pubmed retains no result. What is the reason? Not because Pubmed didn't like the double quotes. In fact, Pubmed accepted it. That is why we are even seeing 0 results. What has happened here is, don't forget what I said earlier, that when you are applying so many filters, be careful. If you don't clear the filters, these filters have applied to this result also. And Pubmed has found that, well, from all the materials that have been indexed, there is none of the results that has this very phrase without any intrusion from another word like the hemorrhagic and those things that we saw. So all I have to do is to clear all these filters and see whether Pubmed will give me any results. Great. So after clearing all those filters, Pubmed gives me 17 results. But of course, these 17 results date back to 2000. So let me bring back my filter for the last 5 years and see whether I'll get any publication like that. Wow, 10 results are gone. So for the last 5 years, we have publications with that phrase, dengue fever prevention. Now again, if you watch the first result here, we have dengue fever as a phrase, but the prevention doesn't follow in the title. Don't forget I said something that over here, we don't have the choice of limiting to where in the database we want the search to happen or which field. So we don't know where it is getting this. Maybe in the full text of this document, we will find dengue fever prevention as a phrase. That is why it has brought it up. But if you look at result number 2, dengue fever prevention occurs as a phrase exactly like that without any words intruding between any pair of the words in that phrase, right in the title. So it says knowledge, attitude, and practice towards dengue fever prevention and associated practice among public health sector healthcare professionals. Have you seen it? Great. So if you look at that same result in the abstract, okay, it says a low level of practice towards dengue fever prevention. So we see that the phrase is captured just like that, not only in the title, but also in the abstract. I'm looking for another one where we can see in a different part. Okay, for example, look at result number 7, the last result number 7. It says direct costs of dengue hospitalization in Zhongshan, China, associations with demographics, virus types, and hospital accreditation. In the title here, we don't have our exact phrase, dengue fever prevention, but in the abstract, or here it says background, okay, you read, it says, Zhongshan city of Guangdong province, China, is a key provincial and national level area for dengue fever prevention. So see that phrase, dengue fever prevention, as you can see, it is even bolded. As a phrase, it occurs in the abstract. So on this basis, we are going to move to advanced search, where we actually have the power to determine where the search engine looks in retrieving our results. Because at this level, it can look anywhere, whether it's in the title, in the abstract, wherever it finds that exact phrase, that is what it was doing. And you can see that once we use exact phrase search, we are able to limit the results even further. So that is another trick you can use in refining your results. Apart from applying the various tools that database provides, like the currency or the date range, like the publication type, whether they are going to be reviews, systematic reviews, or primary research or book chapters, whatever, and whether you want your results sorted in a particular manner, all those things that we used. You can also use the double quotes for exact phrase search as a way of limiting your search or reducing the number of hits.